All right, for this case study, we're case number 6, and my name is Jonah.
I'm Mitchell.
And I'm Eric.
And to start off with this case, I'll just summarize the major findings from the radiology report and the radiographs themselves. So some background, the patient in this case was involved in a car accident and suffered a dashboard injury to his left knee. And given that only his left knee sustained an injury during an accident, they determined that a plain film radiograph was the most suitable imaging option because something like a CT and an MRI wasn't required. And some key factors that indicated that a radiograph was necessary were things like his severe left knee pain immediately after the car accident, his inability to walk unassisted, inability to bear weight, and they may have considered advanced imaging such as CT or MRI if he had any injuries to the spine, but that wasn't the case here. And I found a little research article about advanced imaging in motor vehicle accidents, and this study included 93 patients where whole body CT scans after a car crash didn't lead to any changes in patient treatment. And then for the actual radiographs that were taken of this patient, they chose to do both an AP and lateral view of the knee. And both these views you can see showing a significant transverse fracture through the midpole of the patella. And the result of this was the two large fragments of the patella, the superior half and inferior half, ended up becoming displaced themselves by the tendons pulling on both sides. So the two fragments of the patella ended up being displaced superiorly and inferiorly. And now I'll go and show you the actual radiographs themselves. So this one was a lateral view. And here you can see clearly that the patella is completely fractured through the middle, with the superior half of the patella being displaced superiorly towards the femur, and the inferior half of the patella being displaced inferiorly towards the tibia. And then here's another view from the AP. It's an AP view radiograph. And this one, you can't really see the superior and inferior displacement as much, although you can tell it's there. It's just not as drastic. But this one, you can really see that there's a line through the middle of the patella that shows up as radiolucent on the radiograph, and that's indicating a complete fracture. And then for the next part of this case, I'll hand it over to Eric, and he'll just talk about the patient's symptoms and if they're consistent with the findings of the radiograph.
Okay, so the patient's symptoms were including severe left knee pain right after the car accident, and inability to walk unassisted. They weren't able to weight bear with bilateral crutches, and the knee was in an immobilizer. Based on information from the American Academy of Orthopedic Surgeons, one of the primary symptoms following a transverse patellar fracture includes the inability to walk, which is consistent with its presentation. Basically, all that damage to the patella makes it not function very well, and the quads not function well either for weight bearing. So as far as PT treatment and considerations, the findings from the imaging and radiology report would impact the treatment because the fractured patella, obviously, it's going to need to be immobilized until there's surgery done. So surgical repair would involve partial or complete excision if it's unavoidable, or tension band fixation, which has shown to have good outcomes even with severe comminuted fractures. After the surgery, PT will assist in restoring mobility, strength, and functional movements. Special considerations for this patient, since he is a factory worker, it does include his work environment and his physical demands like squatting, kneeling, climbing ladders, which of course all require the quads. And he does work 10 to 12 hours on concrete. So a lot of things to consider with the PT treatment. And for the education, we're just going to hand it over to Mitchell.
Okay, so due to the patient's low health literacy level, history of poor attendance with therapy, and overall poor health, effective communication is imperative in order to have a positive outcome. Research done by the Journal of Cardiovascular Nursing suggests that strategies such as the teach-back method, literacy sensitive education materials, videos, and easy-to-read signs are beneficial when communicating with patients with low health literacy. For this individual patient, we believe that a simple drawing of the fractured patella or showing him the radiograph would be effective. We would explain our patient's condition in the following manner. Hello, sir. We've just finished reviewing your x-rays, and we've drawn up a summary for you right here. During your accident, your kneecap broke across the middle, separating above and below. Unfortunately, PT will not be able to treat your pain and inability to walk at this time because these two pieces need to be put back together surgically. Surgery is the quickest way to get back to walking, standing, and squatting, so you can do all your roles at the factory. So following this conversation, we would likely conclude the session for the day and not see the patient until after surgery.
All right. And that about wraps up our case study for this patient.